Alison Thewliss.
Thank you, Madam Deputy Speaker. I beg to move that leave be given to bring in a bill to make provision about supervised drug consumption facilities, to make it lawful to take controlled substances within such facilities in specified circumstances and for connected purposes. Madam Deputy Speaker, one of my constituents mentioned to me on Monday that Glasgow already has drug consumption facilities. They're behind the bushes near his flat. They're in his close when it rains. Right now they're also in bin shelters, on filthy waste ground and in lonely back lanes. They're in public toilets and in stolen spaces where intravenous drug users can grasp the tiniest modicum of dignity and privacy for as long as it takes to prepare and inject their fix. Often they're alone, and far too regularly drug users will die as a result. Madam Deputy Speaker, as a society we can and we must do much better than that. There is a real and persistent issue in Glasgow. In 2016 there were 2,593 drug-related deaths registered in England and Wales. That same year, 867 were registered in Scotland, and of those, 257 were in the city of Glasgow. We have an ageing population of people with long-term problem drug use. They are increasingly vulnerable and require particular interventions to reduce harm and encourage them to engage and remain engaged in health services. The largest cohort of drug users in Scotland currently are aged 35 to 44. This ageing population, people who have survived since starting to take drugs in the 1980s and 90s, are in deteriorating health. Due to their sustained opiate use, they are assessed as having a physiological age 15 years greater than their actual age. This population has complex comorbidities with above population level instances of conditions including COPD and asthma, hepatitis C, liver disease, epilepsy, deep vein thrombosis and pulmonary embolism, skin infections and cellulitis, depression and psychosis. This population are vulnerable to overdose and to emergency hospital admission. The Scottish Drugs Forum have carried out research interviews with a large group of older people with a drug problem. This group feel very strongly that they have been left behind, that they are seen as a waste of space. There needs to be a recognition by this House that abstinence-based programmes will not necessarily work for everyone, and that harm reduction and support will be better and more worthwhile interventions for a group of people who have not managed to eliminate drug use in the preceding decades. Madam Deputy Speaker, evidence shows that long-term engagement in treatment is a positive protective factor. The people in Glasgow who would use this facility are not in treatment. This facility would get them through the door, and it would provide a range of other social and medical support to help them stabilise their lives. The report Reducing Opioid-Related Deaths in the UK, published in December 2016 by the Advisory Council on the Misuse of Drugs, recommends that considerations given by governments of each UK country and by local commissioners of drug and treatment services to the potential to reduce drug-related deaths and other harms through the provision of medically supervised drug consumption clinics and in localities with a high concentration of injecting drug use. The report cites evidence which demonstrates that these facilities reduce injecting risk behaviours and overdose fatalities. Furthermore, they say that they have been estimated to save more money than they cost due to the reductions in deaths and HIV infections that they produce. Such facilities have not been found to increase injecting, drug use or local crime rates. In addition to preventing overdose deaths, they can provide other benefits, such as reductions in bloodborne viruses, improved access to primary care and more intensive forms of drug treatments. No deaths from overdoses have ever occurred in such facilities. Madam Deputy Speaker, Glasgow has a proposal, a well-worked-through business case produced by the Glasgow Health and Social Care Partnership, which is supported by the Scottish Government. Drug law remains reserved to Westminster, and Scottish ministers have requested permission from the Home Office to allow for the proposal to go ahead. This has not yet been granted. This proposal has real potential to reduce drug-related deaths and ongoing harm. It is for an integrated service, as also recommended by ACMD, not just a shooting gallery, as some have suggested. It will allow for engagement with a population who at the moment are not being assisted very well at all. There will be medically trained staff who can supervise and administer life-saving naloxone should it be required. Some may say, Madam Deputy Speaker, that this is an unnecessary expense. I should say to the ministers opposite, it will certainly cost them nothing. For Glasgow, there is a significant cost in not doing this. There is a cost in treating the latest HIV outbreak, in treating Hep C and other conditions. There is a cost in emergency hospital admissions and ambulance call-outs, in police time dealing with complaints. There is a significant cost in clearing up discarded needles, residents being charged by their factor for a problem not of their making, and the council picking up the tab for public spaces. A housing association told me how they are regularly paying to clear up areas of hundreds of discarded syringes. A constituent tweeted me today to say that there are syringes on her doorstep. There is an ongoing public health risk to residents who at any time can be pricked by a contaminated needle. And of course there is the intangible cost, Madam Deputy Speaker, in human lives. We should consider all of these costs that we are currently paying in a situation which helps no one. Heroin-assisted treatment has been mentioned as an alternative to a supervised drugs consumption regime, and I would like to touch on some of the limitations of this. The Glasgow proposal does include provision for heroin-assisted treatment, but I'd like to stress while this can be a treatment for those for whom many other interventions have failed, it is not suitable for everyone. There are also capacity and cost issues. Glasgow city centre is thought to have a population in the region of 500 injecting drug users. The Glasgow Health and Social Care Partnership believe that they would only have capacity for between 40 to 60 individuals for heroin-assisted treatment, and only when the service was running to full capacity, which will not happen for some time yet. I understand that this service also requires 2 separate licences to operate: a premises licence, which is in the gift of the Home Office, and a prescriber's licence, dependent on the premises licence, for individual doctors directly linked to the site. It's not a simple process, but it has been developed very much alongside the proposal for a supervised drug consumption facility. Madam Deputy Speaker, to operate a supervised drug consumption facility requires the consent of the Home Office. Those operating, working in and using the facility require protection in law. Hence, my bill seeks to exempt staff and those using drugs within the facility from prosecution, and the removal of liability from prosecution to the operators of the facility, in this case the Glasgow Health and Social Care Partnership. Madam Deputy Speaker, the supporters of this bill come from a range of parties: Labour, Lib Dem, Plaid Cymru and even the Conservatives. In a letter I wrote to the Home Secretary earlier this year ahead of the Honourable Member for Inverclyde's debate, garnered similar cross-party support from MPs right across Scotland. I'm particularly grateful to the Honourable Member for Stirling, who said in giving his support that we should reach out to help those in the grip of drug abuse and do what can be done to help them escape the vile grip of the gangster pushers and dealers. This facility is very much a step in that direction, Madam Deputy Speaker. Madam Deputy Speaker, in my 11 years as an elected member in Glasgow, the issue of drug taking has been a constant. I have seen various police initiatives shunt people around, from bin shelter to close to waste ground. I've seen the council clear up the mess at significant cost and significant risk to their workers. I've seen residents at their wits' end, worried about what they will open the door to in the morning: blood, excrement and used syringes on their doorsteps regularly, daily. I've seen very vulnerable and desperate women and men injecting into their groin in hidden but still public places. They have nowhere else to go, Madam Deputy Speaker. And I've listened to the heartbroken families who have lost loved ones. If it was their choice, they would not have their loved one die alone in a filthy back lane. They would want a medically supervised facility where treatment could be given and help could be sought. The status quo, Madam Deputy Speaker, serves none of these people well. I cannot accept that this is the best that we can do. It's unacceptable. We must try something different. I accept that it may not work, but we must at least try. Today, Madam Deputy Speaker, is International Ask a Question Day, and my question of the UK Government is this. Glasgow has a plan which could reduce drug-related nuisance to residents, reduce harm to drug users and save lives. Will the UK Government let Glasgow get on with the job? Madam Deputy Speaker, I commend this bill to the House.
The question is that the honourable member have leave to bring in the bill. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. The ayes have it. Who will prepare and bring in the bill?
Madam Deputy Speaker, Crispin Blunt, Mr Alistair Carmichael, Joanna Cherry, Ronnie Cowan, Christine Jardine, Stephen Kerr, Stuart C MacDonald, Ian Murray, Liz Saville-Roberts, Mr Paul Sweeney, Dr Philippa Whitford and myself.
Alison Thewliss.
Supervised Drug Consumption Facilities Bill.
Second reading what day?
Friday 27th of April, Madam Deputy Speaker.
Friday 27th of April. Thank you.
Thank you.